Stalker here from WestfordCAT, and I'm with Westford's Health Director, Jeff Stevens, for our weekly Health Department update. How are you, Jeff?
Good, Patty. How you doing?
I'm doing good, thank you. So let's dive right into it. So Charlie Baker has moved Massachusetts back into phase 3, step 2 as of March 1st.
Correct.
And if all goes well, we will move into phase 4 on March 22nd. So the one question I have for you, Jeff, it looks like the numbers are going down. The newly reported cases are going down. First of all, are they going down in Westford as well? And do you attribute it to the holidays that we had such a peak and now it's only natural that the numbers would go down?
So I will tell you this, Patty. I think it's pretty safe to say that holidays and holiday gatherings, and I'm sure there are other factors combined with how any virus kind of cycles with a peak and a dip through its cycle, was the reason why we saw so many numbers and we saw them so high when we did. I kept pretty close track of what our weekly numbers were. And from November 4th through last week, the state has been sending us out the amount of people that have been tested in Westford, and for that matter, every other community in the state, on how many people tested and how many people tested positive. And at times, we saw some fairly high numbers for a community Westford size. From November 4th, we had 16 people that had tested positive. And by December 10th, we had 112 people testing positive.
Wow.
In a 14-day period of time.
Wow.
That continued to climb through January 20th, where we hit our peak, if you will, of not only the amount of people getting tested, which was 2,550 people, and a total positive test within that particular 14-day window was 164 positive tests at a rate of a percent positivity rate for the testing rate of 6.43%, which is fairly high. Since then, we have started to relax through January 27th, all the way through now. We've still testing at a high rate where a lot of people want to get tested. The last week's test number was 2,130 people get tested for COVID. But now only 54 were positive at a positivity rate of 2.54%.
Oh, what a difference, huh?
It's a huge difference.
Yeah.
And really what that percent positivity rate means, for anybody who hasn't seen it or heard what I've explained in the past, the amount of people that get tested is a 14-day window they take usually on Wednesdays. The number of people that test positive is the number of people in that same 14-day window. The percent positive rate is only the people that were tested, not the positivity rate of the town. So that does not mean 2.54% of the population tested positive. 2.54% of the people that tested were positive.
Yeah, thank you for clarifying that, because we've mentioned it before in the past. A lot of people get confused on that number. So I'm glad that you spoke to that.
Yeah, that's always something that I like to make sure people understand. We at no point was 6.78% of the town positive, but that's still a huge number of people testing positive for any disease.
That's true. So, so we are in phase 3, step 2.
Yep.
And we moved back into phase 3, step 1, right after, I think, the Thanksgiving holidays. So now we are back to where we were before Thanksgiving. And so what does that mean in terms of what is going to change for the next couple of weeks, 3 weeks, and then what's going to happen in phase 4?
So in phase 3, what that means is places like restaurants no longer have capacity guidelines that they have to follow, such as the 25, 40, or 50%. What it does mean is that they can make sure that people can sit in their restaurant 6 feet apart.
Mhm.
So whatever their capacity at a 6 foot distance is what they're able to do. So
Gotcha.
in some spaces, that's going to mean a lot more seats. In other spaces, that won't be much of a change from, say, the 50%.
Mhm.
So it gives the restaurants a little flexibility on what they can do. Additionally, the town is trying to make sure that anywhere that somebody wants to go, now that good weather is on the horizon, we should be able to allow outdoor seating in some capacity again as well. So that's going to be an important piece for restaurants, which will again increase their capacity with additional seating outside. So that'll be a nice boost for those places. Other things that changed were places like laser tag, roller skating, trampolines, obstacle courses, none of which we truly have in Westford, but they now can operate at a 50% capacity. Other sectors are now raised to a 50% capacity in what their reopening capabilities are. Indoor performance venues such as concert halls, theaters, and other indoor performance spaces will be allowed to reopen at 50% capacity, but will not be allowed to have any more than 500 people inside. Once we get through, and one other thing before we move on to this phase, some things that have not changed in the restaurant industry is that there is a 90-minute seat time from when you get there to when you leave that still has to be enforced. Within that, you need to order food if you're going to drink any alcoholic beverages, and it has to be prepared food. So those rules have not changed in any of those capacities, and our staff is working to make sure that everyone understands what that means. And most of them do. In fact, all of them do. They understand that that means you go to a restaurant, you sit down, you order food. If you choose to get an alcoholic beverage, then you can order it once you order. And that 90-minute window is what you have to follow. There's a lot of people in the industry that want that to be lifted as well. We're hopeful at some point that can be, but that again will be based off of public health data.
Yep, the numbers, they don't lie. So if all is going well, then we move into phase 4. And what's going to happen there? Is that what you
So,
just said? Indoor and outdoor stadiums and ballparks. That's phase 4, right?
yes.
Okay, great.
So indoor outdoor
Yep.
stadiums will be allowed seating, and that's really aimed more at the professional level. So a place like Fenway Park
Mhm.
will be able to have, I want to say, 12.5% of their capacity, which isn't a huge number, but it's a start for people to be able to go see their favorite teams again. Arenas and ballparks will have all the same restrictions as far as capacity. And what we can hope for is that those things will increase over time, but only if public health data allows for that to happen. Additionally, and this is something important, especially for the wedding planners, dance floors at weddings will allow to be opened. Those events will be allowed to have 100 people on the inside and 150 people on the outside in separate events, not necessarily the same event. So that's going to allow more facilities to be able to run events.
On a side note, you said that good weather's on the horizon. Jeff, it's March 2nd. In New England, good weather is not quite on the horizon on March 2nd.
Hey, I'm personally hoping for a cold snap here. I want one more week of pond skating. So.
Okay, good. So what about the vaccine, Jeff? What's going on with the vaccine in town? I know you had mentioned last week about a collaborative between towns in the area, potentially having one mass site, but the vaccine is hard to find.
So currently what the state is allowing is the mass vaccination sites only.
Mm-hmm.
They are controlling right now where that vaccine goes to those spots. A lot of that has to do with the fact that there is only so much vaccine available, and the mass vac sites is where they feel they're getting the most bang for the buck.
Mm-hmm.
They're working. They're, as much as I want vaccine in my hands to get to our residents, the mass vaccination sites are getting people vaccinated. We're seeing Around a little over 500,000 people now are fully vaccinated with 2 shots. Over 1 million people are vaccinated with at least one. And now Johnson and Johnson is coming online with their vaccine, which is a single dose vaccine.
Mm-hmm.
And all CDC and public health data that I've read appears that this is a very good vaccine and should be used and taken. There's some concern that the efficacy of the vaccine is not exactly the same as the other two, which claim to have a higher efficacy rate. But one thing that's very clear in the public health data is 100% of the people that have received the Johnson & Johnson vaccine have not died and did not need to be hospitalized.
Mm-hmm.
So it's going to do what it's meant to do, which is great news. And it's only one shot.
Right.
One shot is nice. It can be refrigerated. It doesn't have to be handled the same critical levels, which is important. So it will be nice to see that come online and allow, hopefully, if there's enough vaccine, more of it to be passed out to local public health where we can start hopefully vaccinating some of our other populations. That would be good. But that's not a decision I get to make. That's a decision the state has to make.
So are we still at the 65 and older and people with two comorbidity, two morbid? Yeah, there. Thank you. That was a redundant. So, and obviously the public health workers and that, but nothing has changed in that aspect, correct?
At this point, nothing else has changed. That is exactly where we're at.
Now, what about some of these variants, Jeff? Is there fear that they will not be controlled by the vaccine?
At the local public health level, we have to rely on what the CDC gives us for information,
mm-hmm.
because we don't carry epidemiologists on site.
Right.
Nor do any health departments, with the exception of maybe a couple, have anybody running them that is an epidemiologist. So we rely on our data that come from the state of the CDC. And all of our best data and our best information is telling us, yes, the variants may spread quicker, but yes, the vaccine is still effective against them, and you should still be getting vaccinated regardless of the variants.
All right, great. That's good to hear. So, Jeff, anything else you'd like viewers to know?
So I think the most important thing is even though we're starting to see really good numbers in vaccination rates, and we're seeing our case numbers drop, and I still think it's too early to tell that there's an absolute correlation between the two. Mm-hmm. We'll wait for that data to be analyzed before I can really make a comment on that. We still need to make sure we're doing those important public health can't even spit it out today. Actions, which is wearing our masks, washing our hands, and socially distancing, and staying out of large gatherings where we don't need to. We know very clearly, and we know for a fact, that the large gatherings are often the spreader of the virus. So by limiting those chances to be in those groups, we'll limit the spread of the virus.
That's good advice, Jeff. Let's hope that we see things continue on this positive note. And like you always say, there's a light at the end of the tunnel, but it's still a long tunnel. So,
a long tunnel, but there's definitely light.
Okay, great. Thanks a lot, Jeff. We'll check in with you next week. Thanks for your time.
Thanks, Patty.
For WestfordCAT, I'm Patty Stalker.